Hi, I'm Amy Wolf with VUCast. SARS, H1N1, HIV, they all have a common thread. They're viruses that can be spread, and they've created forms of panic worldwide.
The average person touches their face 3 to 5 times every waking minute. In between, we're touching doorknobs, water fountains, and each other.
Matt. Mom? No, go up to your room, honey.
Vanderbilt infectious disease expert Dr. Buddy Creech got a first look at the new medical thriller Contagion. It takes a fictional look at a viral pandemic. He says there are some parts of his own research reflected in the movie.
We're actually using some of the most state-of-the-art technologies that really try to understand how individual people respond to a flu vaccine. And in our case, we're using a bird flu vaccine that wouldn't be too very different than what was portrayed in the movie.
It's figuring us out faster than we're figuring it out.
It's mutating.
And what we're doing is we're looking at individual cells in individual people to look for individual levels of DNA and of proteins to be able to say person A responded in this way because they had these genes and these proteins, or person B had a lot of fever and maybe arm soreness after the vaccine because of these genes and these proteins. And then you can imagine an individualized vaccine program where those who are at risk or those who we know will respond poorly, we could tailor the vaccine.
Creech and a team of Vanderbilt scientists were among the first to test the H1N1 vaccine in 2009. You can read more about Vanderbilt's role in creating vaccines on vanderbilt.edu, search vaccine program. Millions of people pack concert venues for the music event Lollapalooza, but here at Vanderbilt, we're ready to rock the flu shot. Get ready for Flulapalooza. The Med Center is holding a mass vaccination drill on October 12th to not only get lots of folks protected from the flu and H1N1, but also practice an emergency vaccination plan in case there's ever a pandemic. Vandy's goal, 8,000 flu vaccines in 8 hours. You can read more on vanderbilt.edu, search flu vaccine. And don't forget, flu season is right around the corner, so it's time to get your flu shot. You've heard us talk about the power of music helping patients heal. Now meet a Vanderbilt doctor who uses music as his own medical motivation. VUCast Francine Lewis has the story.
Part of having a bad liver is having a large spleen, and this is a spleen over here on the right, kidneys down here, but this is the liver.
So how does a doctor go from this?
There's a lot of information on these images.
To this? For Joseph Awad, a gastroenterologist at Vanderbilt and the VA Medical Center, combining medicine with his passion for music is something he can't imagine not doing.
Trombone and music in general just is a very great relief, and for me, it's my drug, it's my addiction. I just love playing it.
4 before F with the quarter note pickup. 1 and 2 and 3.
His passion even led him to playing an instrumental role, no pun intended, in bringing the International Trombone Festival back to Vanderbilt this year. The festival, which brings together college students, music enthusiasts, and professional musicians, got its start from Peabody College's former music program.
And I will release that note on beat 3.
Like many of us, Dr. Awad sees music as an escape, a way to create harmony in a life that forces him and his patients to face some difficult realities.
When I'm involved in music and things are going well, it's my therapy. It really makes my life to be involved in music.
For VUCast, I'm Francine Lewis.
You can watch several of the Trombone Festival performances. Go to youtube.com and search Vanderbilt and Trombone Festival. For VUCast, I'm Amy Wolf.